Assalamu alaikum viewers, this is Dr. Khawaja Sajjid Aslam, orthopedic surgeon, primary and revision hip and knee replacement surgeon. Today we are discussing about the hip joint arthritis, osteoarthritis. Previously we have discussed about the total hip replacement. Today we'll focus about the osteoarthritis of the hip joint. Usually it happens in elderly people, where the cartilage inside the hip joint started to degenerate with the passage of time, with the age. And then bone tried to rub with each other, with the acetabulum and the head of the femur, try to rub each other and gives pain. Pain originates from the hip joint, typically found in the groin, not on the side of the hip, typically inside the groin. That is the pain originating from the hip joint. But hip joint pain can be felt as a referred pain in the proximal thigh and in the back as well. Lower back pain or in the buttocks also could be because of hip joint pain. So don't think that this pain is just coming from the back. And I've noticed in my clinical practice, many people have been treated over the years just because of back pain, and they didn't get remedy, and at the end they ended up to me, and we got the x-ray and clinical examination, and we found that they had severe osteoarthritis of the hip joint. So hip joint can be felt in the buttocks or in the lower back or the proximal thigh or on the side of the hip or in the groin. But as I said, typically in the groin, pain is coming from the hip joint. So how the arthritis develop, that we have discussed earlier in few programs, that same mechanism as the knee arthritis develops. First of all is because of aging process. With the age, cartilage keep on rubbing with each other and it gets degenerated, and it just wear and tear with the passage of time and life, and then bones try to rub with each other. That's the time where it gives you pain. You can notice a couple of pictures over the screen where you can see how badly the head of the femur have been degenerated, and osteophytes, small spikes of bone has been developed, and the cartilage has been rubbed off. You can notice that. That's the reason why a patient feels pain, and this pain comes with every step of when you walk. Sometimes even during sleep as well, when you try to turn on the bed, you feel pain and you wake up. Hip joint moves with every step. Is different than the upper limb with the shoulder or elbow. But hip joint moves with every single step. So once it's arthritic, it gives you pain with every single step. So it's very important. Once you get this one, you have to get treatment. You have to present to the orthopedic surgeon. The other problem is a fracture. When you get the fracture, which involves the joint, later on it gives you osteoarthritis. Or that's what I explain to my patients when they get such kind of fracture, which involves the hip joint. I told them that, listen, the possibility of early arthritis is more in your case because you got the fracture inside the joint. If your genetics determine that you will get the osteoarthritis at the age of 55, then because of this fracture, most likely you'll get in 50 or in 40s, you'll get this arthritis. So that's another reason as well. Infection could be another reason. If you get infection in the hip joint, later on chances to get the osteoarthritis are more, or early osteoarthritis. Other things are tumor. So the most common problem, most common cause, I would say, about the arthritis is the age. Age is all over the world, not only specifically in Asian countries, but all over the world. So once you get the pain, and you will feel it, because this pain would not let you to walk even up to the toilet. It would be very difficult to use the Asian toilet, the one which is not a seated one, lower one, Asian toilet. That must be very, very painful. And that's the time when most of the patients, they notice that I cannot use a toilet. And then they present to the orthopedic surgeon. We have discussed in detail about the total hip replacement earlier in the program. So don't neglect this one. This is curable problem. Same like total knee replacement is curable. You get completely relief of pain without any medication, and you can walk few kilometers pain-free, and you can spend rest of your life healthy and enjoy. So don't neglect yourself. Present to orthopedic surgeon, and this hip arthritis is curable. Remember, it's curable. On the screen, my contact number is there. So if you want to discuss any topic, any problem of your hip joint, or you want to get any appointment, you can contact me. Thank you.